Welcome to Quick Psychology Facts number 3 with Tempest Psychology. Today we're going to be discussing a service evaluation paper called Psychopaths, is a therapeutic community therapeutic. This was written by Harris, Rice and Cormier in 1994 in the journal Therapeutic Communities. I won't spend time defining psychopathy in this video, as our understanding of the condition has advanced so much since 1994. Instead, I'm going to focus on the study rationale, what they did and what happened afterwards. The aim of this study was to see what effect a therapeutic community could have on the recidivism rates of a group of criminal psychopaths, essentially asking, can criminal psychopaths learn empathy? The therapeutic community being assessed spanned a decade from 1968 to 78 and was housed at Oak Ridge Hospital in Ontario, Canada. This hospital was made infamous for the poor treatment of their patients in various therapeutic initiatives. The dataset consisted of two groups of patients, those with psychopathy and those without. The non-psychopathic group still had to have a psychiatric disorder though. These two groups were divided between those treated in the therapeutic community and those who weren't. Each participant in the treatment group was matched along a set of criteria that is associated with criminal recidivism with someone in the untreated group. These criteria were their age at the time of their index offence, criminal history, type of index offence, and the index offences for each pair of patients had to happen no more than 2 years apart. Overall, the therapeutic community only had a small effect on the chance that the patient would reoffend. Interestingly, for the non-psychopathic patients, 44% of the treated group actually reoffended, compared to 58% of the untreated group. But for the psychopathic patients, 87% of the treated group reoffended, and 90% of the untreated group reoffended. Harris and Rice theorized that this discrepancy in recidivism between the psychopathic and non-psychopathic groups occurred because of the core traits and goals of criminal psychopaths. Those patients in the psychopathic group simply learned how to weaponize empathy and how to use it to manipulate and exploit other people. The therapeutic community taught the psychopathic group how to better recognize and understand other people's complex feelings, along with how to present sincerity and compassion with greater skill. They conclude that while the research doesn't help explain what therapy would work for criminal psychopaths, it does add to the knowledge of what hazards and pitfalls to look out for when treating such a group of people.